The aging population is an issue for the insurance industry around the globe. It is having an impact on several lines of business, only exacerbated by a large protection gap. Here at the Global Insurance Forum in New York, we spoke with Sheehy about the aging population and the health insurance market. He is Global Head of Health Consumer Business at AIG and had this to say.
Globally, there are a number of trends affecting health and the population around the world. One is really the aging of the population. Overall, that is probably the most significant item headed our way. Over the next 5 to 10 years, the distribution of the population is going to change dramatically. And as you might expect, the conditions and health as bodies just deteriorate with age have pretty material impacts on all the social systems, the health system, as well as the economies around the world. So I think really starting to begin now to try and prepare for that tsunami excuse me, that's headed our way is really, really critical. You have other underlying trends about the rising percentage of non-communicable diseases, which really is associated with an aging population. You have trends in wellness, or the people not taking care of themselves, that contribute to all that. So there are a number of other factors that sort of surround the aging population that sort of are accelerators, in my opinion, and things that we need to be very aware of. In developed countries, again, there's a lot of dynamics going on. And it's a very different dynamic whether you have a government-run system versus more of an open market system like in the US. But the underlying ideals are you still have the developed countries, with an aging population. You have rising utilization and health expenses. And when you combine all that, you have a lot of stress on the economics around health and the pressures that people are seeing in their health and wealth protection. How are they going to provide for themselves longer term? If they're living longer, how do they really have that protection? Because health is probably the biggest risk item that they all identify. But what we see is people not really taking actions in these developed countries necessary to protect them longer term. We also don't see governments, and even with a very well-run health systems, really fully preparing for the future. Some of them are now beginning to take steps. I think there is more of an openness to partnerships and collaborations to really protect themselves, whether that's with providers or with insurance companies or directly with the consumer. How do they really begin to educate and prepare people for what's headed our way? Well, in emerging markets, it's really the structure that you have with the health system and how those markets are really trying to even get to the basic care, and particularly with what I feel even in both emerging markets and more developed markets is focus on women and children. They're a very underserved subsegment of every population. But how do you get the infrastructure so you can build off of it appropriately to provide the right type of quality care in the right setting at the right time to help these people have the appropriate quality of life? That's the biggest thing. And then you're going to see that they will continue to have growing populations as they do that with technology and being able to live longer. Their trends could go at a more accelerated rate into the future. I think a lot of the solutions today are really trying to focus on specific issues and improving the quality of life and the health care that people receive both in developed countries and in emerging countries. What we need to do, though, for the future is really move to much more disruptive or collaborative efforts where everybody has a role to play. Not one area, not the medical community, not governments, not insurance companies. There has to be much more of that partnership to get to the solution because we've seen even in the more developed countries, they're still going through the same issues. It's almost like they're putting temporary solutions in place and not trying to really address the longer term issue out there that is really rapidly coming towards us. Well, I think we need to take advantage of the data out there. And granted, everybody talks about big data. What we need to do is really leverage actionable data. How do we get at the things, and how do we create partnerships that include government, that include employers, that include the consumer, that include providers, that include insurance companies? How do we bring them together? You know, examples are driving wellness, really looking at how do you keep people healthier longer. At some points your body deteriorates, but avoiding adverse events and keeping people and holding them accountable for their health and wellness is absolutely key in my opinion. You know, doing that in a way that really drives a much more population outcome approach to all this rather than being reactionary. Oftentimes, if you're getting to the doctor, that means you have something already. How do we really bring in supermarkets and redesign supermarkets to have the healthy stuff up front? Give you information on how to take better care. How do you get better coaches? Using peer groups is one of the best ways to create behavioral change. And that's at the essence what it's all about. How do you create that behavioral change? How do you manage the population with actionable data? And how do you drive appropriate outcomes where people are accountable? Not just one segment of that collaboration, but each party sort of benefits from all being sort of having skin in the game.
For more of our coverage of the Global Insurance Forum from New York, visit the RIN TV On Demand Library.